Welcome to Tuned In with Mike Johnson, a public service of Mount Wilson FM Broadcasters and Global Jazz Incorporated. Now, here's Mike.
Thank you, Al Verdi, and good morning, everybody. Welcome to Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. We like to talk about things on this show that generally are not talked about too much because they just are not known by the general public. And this is a topic that I think really will get your attention and is something that everyone should be aware of. Many people in this country are familiar with breast cancer. Breast cancer is a disease that, of course, has been prominently talked about in the media for many years now. However, did you know there's a thing called male breast cancer? There actually is. It's a topic that we're going to speak about this morning for half an hour. Later on the show, we're going to be speaking with Steve Lathrop. He is a male breast cancer survivor, and we'll get his insight onto what his experience has been. But to begin this morning, we're going to have with us Dr. Nikki Gidwaney, and she is a radiologist with the Marcia Breastlink Center at Dignity Health Glendale Memorial Hospital. Doctor, good morning.
Good morning, Mike. How are you?
Very good. Thank you for being with us this morning. And, again, as I said there at the top, this is something that I don't think people think about very much in regard to what breast cancer is. So I will just ask you, how common is breast cancer in men? So
men actually don't typically get breast cancer, which is why we don't talk about it as much. So in terms of how common it is, it's 1 in 1,000 lifetime chance of getting breast cancer for a man, comparing that to 1 in 8 for a woman. Wow.
So the numbers there speak for themselves. 1 in 1,000 versus 1 in 8. In your experience, have you seen a spread of it? I mean, has it become more prevalent, or has it sort of stayed in the same sort of level in your experience?
So beyond my own experience, actually, studies have been done that show that the prevalence of male breast cancer is actually on the rise. So we're seeing more breast cancer across the board, of course, both men and women, and that's why it's important for us to be more aware and be able to talk about it.
Now, of course, if you're a male person, you've probably heard about women getting mammograms. Can men or should men get mammograms, or is there a different sort of variation there to have men check for breast cancer?
Sure, that's a great question. Currently, there is no standard for screening for men. We are looking at, and when I say we, it's more the organizations that provide the guidelines, such as Society of Breast Imaging, the American College of Radiology. They are looking at ways to streamline those patients who might be at a higher risk and put them through a more of a screening protocol, similar to what women have. For women, we've recommended to have annual mammograms starting at the age of 40. But for men, there is no such thing because it's not a very common disease for men. So to screen, thousands of men to find one cancer, it doesn't make sense. But knowing, when a particular population of men, who are at a higher risk, they could potentially be screened so that we can find their cancers earlier.
In the experience that you've had with the disease and regarding men, is heredity involved? I mean, is there any sort of gene that people look for to see what might be causing this?
Absolutely, and it's the same gene that women carry. So, the most common genes that we hear about are the BRCA1 and 2 genes. Of course, there are several others, but those are the two most common and the most well-known genes so far. And just like women, men can also have that gene. So when we talk about high risk in men, that's one of the factors that we look at. So if they have a female relative, a sister or a mother or a daughter who has that BRCA gene, then it's important for that male family member to speak to their doctor to see if they should be getting screening because they may have that gene as well. Aside from the genes, there are, other hereditary factors and factors of, if the male has also had radiation to their chest for other causes, they may also be at a higher risk of developing breast cancer down the line.
My guest is Dr. Nikki Gidwaney, and she is with Marcia Breastlink Center at Dignity Health Glendale Memorial Hospital. We are speaking this morning about male breast cancer. This is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Doctor, what is a common symptom for male breast cancer? Is there one that is common amongst the cases that you have seen?
So the more common reason why men would present to a breast center would be that they feel a mass or they feel a lump.
Okay.
And that is usually the reason why they would come in to get a checkup, and they would get a mammogram and ultrasound similar to what we would do for a female patient. So the key point there that I would like to emphasize is when they show up at that point, usually that's a later stage of disease, which carries with it a poorer prognosis, as you can imagine. So these cancers are usually larger because they're now being able to be felt, and so they're usually stage 3 or stage 4 sometimes. So, that's the part that is very, very key for us to realize is a female who gets detected with breast cancer through a screening mammogram, her cancer gets picked up much earlier, and therefore she has a much better prognosis. For a man, because they show up later, it's usually not a good prognosis.
Wow, very, very, very scary. What should men do when they have a concern?
So the key thing is once they do feel something, or they feel that there is something changing in their breast, or one breast feels different than the other breast, make sure not to ignore it. I think it's commonly overlooked because men can, they can attribute that symptom to maybe pulling a muscle, or they might think it's just they lifted something and maybe it's just a bruise, but not to let it go, to make sure that they do address those concerns and they do have a doctor check it. And having a test and checking it out can only give us some more key information. And I think it's important to be on top of their health. I know it's easy to let things go, but that would be the best thing to do.
Yeah, I mean, and your point is definitely well taken. I think there are a lot of people who think, well, I'm just getting older. Well, I flipped up that box. It was kind of heavy, and I dropped something on myself, and reasons to rationalize why it could be anything not so serious.
Correct. And for a female, because we hear so much about breast cancer, we have a lot of family members or friends who have been affected by it. So there's a lot more conversation around breast cancer in women, which is why it may be on the forefront of their minds when they do feel something in their breast. But for men, there's not a lot of conversation around this topic. They may not even realize that they can actually get breast cancer.
Yeah.
So it's not the first thing that comes to their mind when they feel something abnormal.
Yeah, and I think that's definitely the case. And that's why we're doing this program this morning, is because I think that the idea that breast cancer is only for women is just, well, obviously it's not true. But I mean, the perception might be there just based upon so many things in the media that people have heard and talked about. But breast cancer in men is a real issue.
Absolutely, and I'm so glad that you're spreading awareness. You're bringing this topic to the forefront of the our audience, so that they can also share it with their loved ones.
Are there any differences in the kind of breast cancer that men and women get?
No, actually, typically they're both very similar cancers, and their treatments are very similar as well. One key thing that I guess could be different is for women, if the cancer is small enough, they could do a lumpectomy, which means just removing the area of cancer. Whereas for men, there's not a lot of breast tissue, so they end up usually getting a mastectomy.
Now, are there any differences in how men and women cope with the disease and cope with getting breast cancer? Because I mean, the perception is that women may be more nurturing and men may be more, quiet and unwilling to share their feelings. Is that the same in your experience?
Actually, it is, Mike, and it's really one of the things that I would love to change down the line. I'd love to, find a way to help this, not be such a huge issue. I think that for women, because there is such a, there's so much more knowledge and awareness, and we see a lot more people who are affected, that they have a larger support network. There are a lot more avenues for them to share and discuss and empower one another. For men, first of all, breast cancer, it almost carries like a stigma. There's a psychological stigma associated with it because it could be perceived as a woman's disease, and so that in itself may limit how much a man would be willing to share. And then even if they do decide to share, there's not a lot of places. There's not a lot of avenues for them to discuss and share to gain that support. So naturally, there's a lot of isolation, and depression could come out of this as well, which is very tough. So I think it's important, like we said, to help people realize that male breast cancer is real. and it's not just a woman's disease. It does affect men.
My guest is Dr. Nikki Gidwaney. This is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Dr. Gidwaney is with the Marcia Breastlink Center at Dignity Health Glendale Memorial Hospital. And we're speaking this morning about male breast cancer, a topic that may not be the first thing you think of when you hear the words breast cancer, but it can definitely affect men as well. Doctor, you spoke there briefly about depression. Amongst the clients and the people that you have worked with who have experienced breast cancer, is depression common?
In terms of men and women,
sure,
definitely.
Yeah.
It's something that does arise with any type of chronic illness, and cancer can be a very chronic illness, especially when people come to medical care later, and it can have a lot of impact on their social, their personal, their family lives, not to mention professional lives. So definitely, it's a multifaceted disease that does, go beyond just the actual physical ailment. And that's why I think it's really important for medical professionals to recognize that they're not just treating the disease, but they have to really treat the entire person. And their, psychology is a huge component of that disease as well.
So genetics, are they definitely a factor in breast cancer?
It's a factor, yes,
yeah.
but not all breast cancers are genetically linked. In fact, most aren't. So when we see breast cancer, people oftentimes are surprised and they say, well, nobody in my family has breast cancer.
Right.
And that's typical, because for most people, it's not a genetic or a hereditary disease. So when we think about breast cancer, it's not always familial.
Are there risk factors for breast cancer?
Absolutely, and very similar to all cancers, lifestyle is a huge risk factor. So maintaining a healthy weight, eating healthy, not smoking, limiting alcohol intake, all of those factors are very key in keeping a balanced lifestyle and reducing the risk of developing breast cancer.
So now, doctor, what advice do you have for the men listening to this radio program this morning?
So my advice would be, if you are feeling something abnormal in your breast, don't ignore it. It could be something simple like a bruise or a pulled muscle, but let's make sure that it's not cancer. So please make sure that you see a doctor as soon as you can once you do notice any changes.
Dr. Nikki Gidwaney, thanks for being with us this morning.
Michael, thank you so much for having me.
This is Tuned In from Mount Wilson FM Broadcasters. That was my guest, Dr. Nikki Gidwaney. She's the first guest this morning on our topic, male breast cancer. After the break, we'll be hearing from Steve Lathrop. He is a male breast cancer survivor, and we'll hear from him in just a moment.
If we could pack our kids in bubble wrap, we'd do it, because we love them and we want to protect them. This is Lisa Edelstein with an easy way to protect your kids 3 times a day. Choose healthy foods. Research has shown that a vegetarian diet rich in fruits and vegetables can help protect our kids against obesity. It can even help keep them from developing heart disease or cancer when they grow up. To learn more, call 866-906-WELL or visit cancerproject.org. This message brought to you by the Cancer Project.
And welcome back to Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. Our topic this morning is male breast cancer. It's a topic that people don't think about very often. Well, it can happen. It can happen to anybody, and it's happened to our guest. My guest this morning is Steve Lathrop, and Steve is a survivor of breast cancer. Steve, good morning.
Good morning.
Thank you for being with us. And like I say, Steve, this is a topic that I don't think people really generally have at the front of mind. Did you have any concept about having breast cancer?
None whatsoever. I had no idea that men could get breast cancer, and everything that's published and all what you read or hear on TV or radio, it's only referring to women as far as breast cancer goes.
So how did it come about? Were you feeling as if there was something going on, or did you just have a normal checkup and it was diagnosed?
Kind of like the normal checkup, I routinely go to a dermatologist just to make sure the skin is good and I don't have any issues with maybe a small area that might need to be frozen off or whatever. But anyway, during the course of the examination, she spotted something with my right breast, specifically the nipple area, that didn't look right, according to her. So she asked if she could take a 4-millimeter punch biopsy, which is what she did.
Okay.
And she told me that she would send it to the pathologist, and it would be about 2 weeks. And I said, okay, I've got to go on another mission anyway. So I came back in 2 weeks. This was in June. This was middle of June when I had the appointment.
Okay.
So now we're into July, and I had already been receiving phone calls by the time I got back in country, and I kind of guessed what she was going to say, but then she called me a few hours later again and told me that I had ductal adenocarcinoma with the right breast.
When you're informed with that, I mean, when someone is telling you that, does that even seem real?
It didn't at first. I mean, like I said before, I was shocked. I just had no idea that men could get anything like that.
Sure. Well, now, again, they did the test, and when the idea of doing this biopsy came up, I mean, were you sort of, kind of an ensconced look about it, thinking, well, this is just silly, this is ridiculous? Or did you feel that the doctors are the doctors, they must know what they're talking about?
I kind of felt that she gave me a positive feeling that she knew what she was talking about. So, I allowed the punch biopsy, and I was, of course, glad I did. I'm glad I found out when I did that I had cancer. And
if it had gone undetected, I mean, what would have been your life expectancy?
I don't know. As it turned out, it was stage 2. I think you go up to stage 4 and you're in trouble.
Yeah.
It was spreading with other tests that were done. They detected some spreading into the lymph nodes. So it wouldn't have been good, probably.
Yeah.
I could not say exactly how many years I would have had, but I definitely would have ended up probably going into chemo and radiation maybe to help combat the disease.
So you had surgery?
I did. I had what was called by my surgical oncologist a modified radical right breast mastectomy.
Okay.
And during that period, the tumor was removed as well as 5 lymph nodes down my right side, just to be sure that there wasn't any more cancer, because cancer was already discovered in at least 1 lymph node, and so she took out some extras during the surgery just to make sure that we got it all.
Well, now when you're informed that the cancer has spread, of course, this gets your attention right away. Being aggressive and trying to fight it, I'm sure that's important.
Yes, it is, and I want to state up front here that because women's breast cancer is so prevalent and publicized, the women have a lot of places to go and people to support them and so forth, and I had none of that. I had to basically find a surgical oncologist to perform the work and go from there. And fortunately, I did.
How much legwork did that take?
Not a great deal. My fiance, she works in a hospital, and she happened to know the name of somebody that she thought might be good, and so I hooked up with her.
My guest is Steve Lathrop, and he is a male breast cancer survivor, and this is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. So, Steve, we talked about that you had the surgery, and they removed some lymph nodes as well. The next step, what happened next?
Well, they, of course, it was sent to the pathologist again to make sure that everything was that the cancer was removed from, of course, my breast area, and then checking on the lymph nodes that were also removed. And it turned out that 2 out of the 5 lymph nodes were positive for the metastatic tumor.
Oh, my.
But the other 3 were not. So that was encouraging. And so we discussed my options going forward, which would have been also chemotherapy just as a backup procedure, and also possible radiation. And because of the results, I decided I wasn't going to have chemo.
Okay.
And I was pretty negative already with the radiation because I just don't like that procedure unless I was desperate. So,
did your doctors agree with your assessment, or were they sort of trying to steer you toward the chemo?
They not necessarily. They just wanted me to consider it.
Okay. Okay.
My surgeon was trying to steer me towards the radiation,
okay.
And I didn't really like that. I mean, I suppose if things had been different on the outcome of the surgery, then I probably would have gone to that. But as it turned out, my oncologist recommended I start taking tamoxifen, which is it's supposed to help prevent breast cancer. And you recommended 5 years, and that's what I've been taking since the beginning of this year. So,
when you're having to live with this and you know, go about your daily business, does it ever flare up in a way where you feel like, no, I don't feel right? Or are you sort of confident right now with what the doctors have done?
I'm pretty confident. I mean, the area where the surgery was, of course, it feels different and strange. But other than that, I feel good. I'm still exercising. And I promised my oncologist I would go for a periodic, either an MRI or a PET scan, and just make sure that there's nothing else that is going to come back. So
when you first were looking at yourself and you saw what I guess was a rash on your chest, did you just think, oh, this is weird, maybe something with the soap I used, or what did you think was happening that early on?
You mean before I went to see the dermatologist?
Yep.
I didn't even see any indication to me that something was wrong. And she spotted it right away. I guess the nipple was slightly inverted. And to me that...
Okay.
I'm just a stupid man, I guess. But to me that didn't seem all that strange. And other than that, I didn't really feel anything wrong, but like I say, I just decided to go to a dermatologist and check everything out, and she spotted it right away.
So now, I understand that there can be swelling and there can be even discharge from the nipple. Did you have any of that?
None.
Yeah. So unfortunately, it's the sort of thing where you just sort of by chance were there and thought you should be looked at, and it was caught. But this sort of thing, obviously, it can affect people, even if it's a minute number. It's worth checking out, isn't it?
Most definitely. I would recommend, men, just be really proactive about their health and definitely go see a dermatologist, if nothing else, depending on the age. For my age, I'm going to do it once a year. Continue to do that, but I would, make sure everything is good to go.
And heredity. Had you ever heard of anything like this anywhere else in your family tree?
Not at the time, but I did discover later, because I have some double cousins, and one of them actually had male breast cancer.
Oh, wow.
That I didn't even know about. I'd never got the word about it. Whether or not that's going to affect me going forward, I don't know, but it's not necessarily caused by something in your family tree. It just happened.
Have the doctor said anything about your diet? Have they advised you to eat more fruits and vegetables or this sort of thing? Or are you sort of just picking up where you were before the surgery?
I already do all that anyway.
Okay.
I eat very healthy. I don't go to fast food restaurants or anything like that.
Understand.
Yeah.
Well, making sure that you're healthy is always important, and making sure that you know your body is, of course, so much of what you can do for yourself. Going to the doctor is, of course, very important, but making sure that if you see something that feels a little bit off or looks a little bit off, it's probably a good idea to get it checked out, isn't it?
Absolutely. I highly recommend that people just don't think that, oh, well, maybe this will go away and, kind of like forget about it.
Right.
I mean, if you see something wrong, I would definitely have it checked out.
Steve Lathrop, thanks for being with us this morning.
Oh, you're very welcome. It's my pleasure. I just I'm trying to get the word out as best as possible because, as you know, most men have no idea about this.
You're absolutely right, and myself included. And, that's why we're doing this show this morning, is to make sure that people have an understanding that male breast cancer is a real problem. It is an issue that definitely cannot be ignored. If you ignore things with your body, there can be bad consequences. My name is Mike Johnson. Thanks for listening to Tuned In.
Thanks for listening to Tuned In with Mike Johnson. To contact Mike, email him at tunedinmj@gmail.com. That's tunedinmj@gmail.com. Or write Mike Johnson, Tuned In, P.O. Box 250028, Los Angeles 90025. Thanks for listening and staying tuned in.